Hi, you're watching the right video if you've been instructed that you're going to be either using a Lupron or a Lupron HCG trigger. So as I mentioned in your original instruction video, that Lupron or Lupron HCG triggers are compounded medications that should have been kept in the refrigerator. So hopefully your medication has been in the refrigerator. If you have not refrigerated this medication at any time, or you realize that it's been left out, please notify us as soon as you know that, because that medication will no longer be potent. So we don't want to risk having the entire cycle go to waste if you don't use the proper medication to trigger ovulation. So please let us know so that we can replace it for you if that's necessary. But again, this medication should have been refrigerated because it's compounded. So typically, it just depends on your response if you're going to be given Lupron or a combination of Lupron with HCG. And this does come in many different formulations, so it can get a little bit confusing. So I'm going to try to walk you through this as much as possible, but I will remind you to please look at what you have ahead of time, so that if anything is unclear, you have the opportunity to bring it to the clinic so that we could take a look with you, okay? Or you could take a picture of it if you don't want to, obviously risk it going bad if you're not refrigerating, it properly. So you could just take a photo of what you have, and then we can clarify for you really, really easily. Because part of this is that it depends on the pharmacy that you got it from. They may mix it differently. So that's part of the confusion. So let's just go through Lupron first. Lupron can be used alone to trigger ovulation. And so there are times when patients who have high estrogen levels and high response that we may decide to use Lupron only, but that's maybe not the best for everyone. So that's why there's also the combination of Lupron with a low dose HCG with it. So typically when you get the Lupron, it's going to come in a vial of its own. I think that's pretty consistent. Usually it's been mixed up already and it's ready to use. You just want to look on the bottle to see what it says, and you should usually say Leuprolide, okay? Leuprolide, Leuprolide. And so, for example, Leuprolide trigger, and it says 5 milligrams. So the dose is usually between 4 to 5 milligrams. So this is kind of the way that it usually looks. It's in a little vial with the cap on it. So you just want to take that off, clean it, and draw it up. And usually you're going to have a 3 millimeter syringe at your disposal that it should have come with. Okay, so you'll use the big needle, tip this over, draw it up, and then do the injection if you're only doing Lupron, okay? And of course, I forgot to say, you want to switch it to your small needle, 27 gauge needle, to do the injection, okay? You want to clean your skin, of course, like you always do, and do the injection. And that's the Lupron. However, there are times when you're going to be also prescribed to do HCG, and sometimes when your doctor may be uncertain if you're going to need just the Lupron or if you're also going to need HCG, they may just order both as a split, meaning 2 separate injections, so they have options to select one or the other for you, because sometimes it's towards the end when we find out which may be most appropriate, and it's just nice to have both options available to us. So typically I would say the pharmacies usually will give you the 1 vial of the Lupron, and that'll be clearly labeled. And they may also give you another vial that looks similar, and it'll say HCG, okay? And it's usually 1,000 IU or 1,000 units. That's what we prescribe. And so you never want to just do HCG alone, because that would not be enough medication at that dose to trigger ovulation the way that we feel is optimal. So basically, if you're told that you need the Lupron HCG trigger, you'll want to do both. So the HCG may come in a vial form that looks very similar to the Lupron or Leuprolide, and then you could potentially get the big needle, draw up both vials of the fluid, and just give yourself 1 injection. But there are other pharmacies that will also give you a separate syringe. It might look like this, it might look a little different, It may look like this with a stopper on it that you have to switch out the stopper and put in a 27 gauge needle. So in any case, if it comes in a pre-filled syringe form, then you know that you're gonna do your injection of the Lupron, and then whichever, the syringe that you get of the HCG, you're gonna inject that as well. So you'll be doing 2 shots for your trigger shot. Now, where it gets a little bit more confusing is if they give you a full box of the HCG hormone. So there's 2 brands, Novarel and Pregnyl are both HCG hormone, and they come in boxes where there is either 5,000 or 10,000 units of HCG. I would suggest that if you have that formulation where you got it in a box, please bring it with you to your appointment so that we can look at it and teach you the proper way to dilute it and to draw up what you need in person. And it may be that it's the easiest for you if you just bring it to the clinic, so that on the day when we decide that you need a Lupron HCG trigger, that we just draw you the appropriate dose. Because what I would not want is for you to mix the whole thing and give yourself either the full 5,000 or the full 10,000 units of the HCG. That would be way too much and could be dangerous. So if your pharmacy dispensed the HCG in a full box where it says 10,000 or 5,000, either Novarel or Pregnyl, please bring it to the clinic so that we can help you learn how to do it. I don't even want to go into how you would mix that on this video, because I'm really nervous about you doing it inappropriately, because if you were to mix it, we just got to do it properly so that you only get the small dose. But it is nice sometimes for some patients, the physician may dictate that they want you to be prescribed the full package of the Novarel or Pregnyl, because they think there might be a chance that they want to use the full dose and want to have that as an option. So that's why it's really important that depending on your situation, we look at what's appropriate. If on the evening of the trigger, you have not gotten instructions and you're supposed to be doing just 1,000 of HCG, I can't imagine that happening, because when we call you to do the trigger, they will be talking through your medications. That would be the best time to bring up, hey, I forgot to bring it to the clinic, but I have a full box. I don't have a pre-filled syringe or a vial of just a little bit of HCG. That way your provider who's calling you can go over that with you on the phone and teach you as well. And hopefully by then you are familiar with mixing medication, so you'll know how to do that. And also, if it ends up being that your doctor wants you to use the full dose that's available, then we can also refer you to Freedom MedTeach to teach you how to do the traditional way of mixing it when you're using either 5,000 or 10,000. This comes with a giant bottle of fluid. You don't need all of that. You will only need the amount. Usually depends on how we're mixing and diluting the medication. That's why it's a little bit complicated. So please, please, please get personalized instructions if you've gotten the full box and a mixed bottle of the HCG. Okay, thank you. And again, please reach out if you have any questions about your trigger shot. We're always here, even late at night. Okay, thank you.